Let's begin by examining a phenomenon that represents both a remarkable technological shift and a troubling indictment of our healthcare system. Millions of Americans are now consulting artificial intelligence for health guidance before, or instead of, seeing actual doctors. The push factors driving this behavior are straightforward and depressing. Healthcare costs in the United States are prohibitive for enormous segments of the population. Even people with insurance face high deductibles, copays, and out-of-network charges that make routine doctor visits financially burdensome. Waiting times for appointments have grown longer, with some specialties requiring weeks or months to see a patient. For people without insurance or with inadequate coverage, the barriers are even more severe. When getting medical advice means choosing between paying rent and seeing a doctor, or waiting 3 weeks for an appointment about a symptom that's worrying you right now, turning to free, instant AI assistance becomes rational. The pull factors are equally powerful. ChatGPT and similar AI systems offer immediate responses at any hour, require no appointment scheduling, involve no waiting rooms, and provide a conversational format that feels personal and responsive. There's also genuine anonymity. People can ask embarrassing questions, describe stigmatized symptoms, or admit behaviors they'd be reluctant to share with a human doctor without fear of judgment. This psychological safety is particularly valuable for mental health concerns, sexual health issues, or questions about substance use. Demographic patterns reveal interesting adoption trends. Younger, tech-savvy users who've grown up with internet search and chatbots find AI health consultations natural and intuitive. But older adults with mobility limitations or transportation barriers are also turning to AI when getting to medical appointments is physically difficult or impossible. The technology crosses generational lines in ways that other health innovations haven't. The perceived accuracy of AI responses, whether justified or not, increases adoption. ChatGPT produces fluent, confident-sounding explanations that often include medical terminology and logical reasoning. For users without medical training, these responses can seem authoritative and trustworthy, even when they contain errors or oversimplifications. The conversational format creates an illusion of personalized attention that feels qualitatively different from reading generic health websites. However, we need to talk about the downstream effects. On one hand, AI consultations might reduce primary care visits for truly minor issues like the common cold or minor skin irritations. This could theoretically free up appointment slots for patients with more serious needs. On the other hand, and more concerning, AI advice might delay diagnosis of serious conditions. Someone experiencing early cancer symptoms or a cardiac event might be falsely reassured by AI responses and postpone seeking care until their condition has progressed. There's also the problem of eroding the doctor-patient relationship. When people increasingly turn to AI for health information, they develop less rapport with human providers and may be less forthcoming during actual medical visits. The rich contextual knowledge that comes from longitudinal relationships with patients gets lost when medical information becomes transactional and AI-mediated. From a policy perspective, the massive adoption of AI for health advice should be a wake-up call. The solution isn't to ban or restrict these tools, which would be both impractical and ignore the legitimate needs they're addressing. Instead, we need to improve telehealth coverage and accessibility so people can reach real doctors more easily. We also need public health campaigns about safe AI use that help people understand what AI can and cannot do, when to escalate to human care, and how to evaluate the reliability of AI-generated health information. The popularity of ChatGPT for health questions is a symptom of systemic failures in healthcare accessibility and affordability, and addressing those root causes is more important than focusing on the technology itself.